immunology, blood transfusion reactions. All right, so these aren't too high yield, but you can see questions relating to them. The first and most common is going to be a type 1 hypersensitivity reaction known as allergic or anaphylactic reaction. What happens here is that most patients have IgA deficiencies. So when they receive a transfusion, then it's going to have IgA in that blood. And so since you've been so deficient in IgA for so long, when it sees IgA, it's going to recognize it as a foreign antigen. Okay, so you're going to have an anaphylactic reaction, and it occurs within minutes, okay? Within minutes to 2 to 3 hours. And it's due to release of preformed inflammatory mediators, all right? And that's going to cause degranulation of the mast cells, right? It's just an anaphylactic reaction. So you're going to see urticaria and pruritus. You can have wheezing and hypotension and respiratory arrest because of the histamine release, all right? Next is going to be acute hemolytic transfusion reaction. So this is when we transfuse someone the wrong blood. All right. What happens here is that you have a fever with hemolysis within 24 hours. You could also see hypotension present. It's a type 2 hypersensitivity reaction because it's going to be essentially preformed antibodies attacking our own cells. All right. Next is going to be febrile non-hemolytic transfusion reaction. For febrile non-hemolytic transfusion reaction, what you need to know is that it causes fever without hemolysis. So acute hemolytic transfusion reaction is going to have fever with hemolysis, and the patient is going to present with like flank pain and hemoglobinuria and jaundice because of that hemolysis. Whereas febrile non-hemolytic transfusion reaction, it's in the name. It's fever without hemolysis. And it usually is just due to cytokines that are essentially kind of overproduced in the donor's blood as it sits over time. So cytokines created by the donor, white blood cells, that accumulate during storage of blood products, okay? Next is going to be transfusion-related acute lung injury. This is TRALI. If you ever see any association with the lungs, like pulmonary edema, this is going to be probably your answer. Lastly, you have delayed hemolytic transfusion reaction. This is usually going to be due to minor blood groups like RH, and once again, not too high yield. All right, so this is our immunological blood transfusion reactions.